Make a start. I know more people will join. So I'm Len Gray, for those of you who know me, and welcome to people that haven't been to one of these sessions before. Before we commence, I'd like to acknowledge the traditional owners of the various lands on which those in Australia live and work, and pay our respects to elders past, present and emerging. And if anybody of Indigenous background is here with us, a special welcome to you. Welcome to Public Forum for interRAI for the year. It's been a good year, I think, in terms of advocacy for interRAI and developments here in Australia. So we'll talk a little bit about that in a moment. Just briefly today, we're going to, the main focus of our meeting today is to talk about the Kinnexus development that we've got Meagan Snewin from the Digital Health CRC who'll introduce, Beda and Ilya from Beda Software who'll present the solution they've developed, and I think you'll find that very interesting if you haven't already seen it. So from the point of view of interRAI, I'll just spend a few minutes thinking about where we are or talking about where we are strategically in Australia, and then I'll hand over to Meagan to talk about the Kinnexus effort. And we do run a pretty significant effort in regard to marketing that Lisa, who's on the call, Kapamagian, actually helps us with, and she does just a sensational job. And we keep track of interest in our website and in our various social media efforts, and all the indicators there are that there's more and more interest out there in the community and amongst yourselves in what we're doing. And I think that relates to a variety of other things that are happening in Australia that where interRAI may or may not have a role in contributing to particularly to aged care in Australia. So I mentioned the Sparked initiative that's being led by CSIRO and is supported by the Department of Health and Disability and Aged Care, and that's a really significant effort in Australia, which is aiming to reform or introduce data standards for healthcare in general, but it has commenced work recently in the aged care space, and we're hoping that effort, which goes to particularly to interoperability standards like FHIR, will provide an opportunity for interRAI to insert itself into that kind of world, but that's something that we can talk about in another time, I think. The Department of Health, Disability and Aged Care is running a major review at the moment that I'm personally involved with and some of my colleagues, which is considering the current data holdings of the department and the reporting arrangements to the industry, and that obviously raises questions about what clinical and care related information is being recorded in the aged care program and how well that's organised and how it might be improved in line with the department's own data and digital health strategy, which it published in 2024. So there's a lot of movement in the informatics world and in the Department of Health around reviewing how data is collected and how it's used, and I think interRAI is trying to be part of that conversation. I've mentioned marketing, and finally I just wanted to say something about the Aged Care Data Compare project, which concluded mid-year, and Kinnexus, which is one of the important outworkings of our work in the Aged Care Data Compare project, and that, as you'll probably see as you see these presentations today, may have important implications or create opportunities for interRAI to be used in Australia. And I think it's attempting, and I think Meagan will talk about this, is to tackle the problem of how quality indicator data is recruited in the residential aged care sector at the moment, and how that data is aggregated and dispatched to the department. And it's a kind of clumsy process at the moment. The department's trying to reform that process, and we think the Digital Health CRC's proposed solution, Kinnexus, might have a very important role in reforming and making that process more robust and efficient. And the important thing about Kinnexus, as you'll learn, is it's kind of using the interRAI long-term care facility assessment as the basis for collecting information around quality indicator calculation. And in that respect, it's promoting and demonstrating the value of interRAI, along with many other important features that it has that you'll hear about in a minute. So with all of that out of the way, I'm going to hand over to Meagan, who's going to tell us about the Kinnexus effort and maybe other things that the CRC is doing that might be relevant to what we're all interested in. So over to you, Meagan. Thank you very much for joining us.
Thank you, Len. Hi, everyone. Len, it is great to see so many initiatives happening in this space, all leading into this road of data standardisation and digital transformation in aged care. So I'm here to talk to you about what we've been doing in the last 6 months with Kinnexus. I have got with me here today Ilya, Beda and Yana Beda, who are from Beda Software and have been our development partner in this work. Just a quick overview of what I'll go through today, and in the spirit of reconciliation, Digital Health CRC acknowledges the traditional custodians and the lands throughout Australia and their connections to land, sea and community. We pay our respects to elders past, present and extend that to any Aboriginal and Torres Strait Islander peoples today. In particular, I'd like to recognise that data and digital can and should play a role in addressing inequities that are still experienced by Aboriginal and Torres Strait Islander peoples today. So just by way of introduction, I'll go over what Kinnexus is and drill down into our user stories, which really have provided the basis on which we've been developing. I think Len sort of went over the high level one, which is aged care providers have myriads of systems which they're finding it very difficult to report on the QIs to the department. We've got people doing paper-based assessments and then typing into the spreadsheets provided by the department, and then we've got other providers which have 4 or 5 up to 6, 7, 8, 9 systems which are then trying to extrapolate that and populate the spreadsheets as well. So one of our key user stories is around how we bring efficiencies and effectiveness to that process, and the other one is obviously supporting nurses and clinicians as linchpins of the aged care system in providing them a basis to record standard data for clinical assessment of an older person. So I'll go through in a bit more detail those. We'll look at what is Kinnexus for those who haven't been following us along this very busy journey in the last 6 months. We'll have a demonstration by our development partner Beda Software, and we've got some Q&As. I will quickly go over what's next for us in the next 6 months, and as Len said, it's a hugely exciting space. I can really see momentum building here. I think much of the focus in the last 3 to 6 months for this sector in particular has been obviously bringing in the Act, but I think now is the time to mobilise the aged care providers and start to really put some rubber on the road in terms of digital transformations. So I think this is a very busy slide, and I have talked a bit about this, but nurses are doing aged care assessments in a range of different ways, and I think with our work with vendors, what we've found is that there are lots of different assessments provided in lots of different systems, and not a lot of them are populating the basis for the quality indicating report as part of the National Aged Care Quality Indicator Mandatory Program. So what we have done is we have used interRAI long-term care facility assessment as a basis to map other data in from vendor systems to provide a basis for that standardized data. So use that all the way through into the QI reporting for the department, which has been great. So this is all about a mantra of collect once, use many times, and having that data flow through the system. So that's what Kinnexus is. This is one of the main pain points that Kinnexus is trying to address. The other pain point we're trying to address is, if we have lots of assessments going on, how do we then aggregate that data in a way that makes it more seamless for a quality coordinator in a residential aged care facility to send that data off to the government? We've got our Beda APIs working. I'll get Ilya to give us an update on that. So sending that data through to the government. So we've been able to then standardise the data that's coming through the assessments, generated in a way that's aggregated for the purposes of reporting to the department, and have that sent off electronically to the department. So that's been a large piece of work that we've been undertaking in the last 6 months. So really heavy development and lots of support from our colleagues at interRAI Australia and UQ in developing a very robust set of algorithms and rules to generate and map interRAI through to the National Aged Care Mandatory Quality Indicator Program. And so we're just starting to do some testing in that and see the results, which have been great. Kinnexus is all designed to support efficiency and have the ability for nurses and clinicians to be able to spend less time on admin and more time in care, but also to provide them better insight at the point of care. So when they're doing their assessments and or when they have the aggregated data, to be able to use that in a way that they can then bring in any clinical interventions that they need and to be able to focus on residents' wellbeing. So always with the consumer or the resident at the heart of everything we do. Len sort of touched on this. We have finished a 5-year research program in Aged Care Data Compare, which brought us to, having trial at Regis Aged Care and having lots of technical artifacts. We then went on to support 2 different pieces, consulting work and reports. So one was jointly commissioned by CSIRO and Digital Health CRC, which was the Australian aged care data landscape. Again, it highlighted the complexity, fragmentation and unreliability of the data that was being collected in a manner of different ways, and revealed the duplication of effort between different sectors, primary care, acute care and aged care. And the other piece of work that we've done, both QR codes are on the screen, is we looked to semantic consulting to do a study around what it would take to implement interRAI in Australia, which resulted in a recommendation of developing a smart on fire app, which is Kinnexus. So Kinnexus is a scalable and sustainable working piece of software, not a prototype, that we're looking to build once and deploy many times with integrating with aged care software. So I think it's now over to the demonstration. So a bit more about what is Kinnexus before we move into the demo. So as I mentioned, it's based on interRAI long-term care facility. So it's mapped the vendor clinical information systems. We're working with Bleed Care into AU Core. That is then represented as FIRE through an interRAI long-term care facility assessment, generating the quality indicators per the aged care National Aged Care Mandatory Program, and then sending to B2G. So this is probably an oversimplified diagram of representing what it does. So I will hand to Beda to show you more about and demonstrate the functionality of Kinnexus. Over to you, Ilya and Yana.
Thank you, Meagan. I will start with showing a Kinnexus Smart Launch and fill in the assessment, and after that I will pass it to Yana, so she will demonstrate integration with B2G API. Yesterday there was HL7EU connectathon with support of Spark, and during this connectathon we presented Kinnexus, and during the connectathon we tested integration between Kinnexus and MediRecord's PMS system. So I will demonstrate how it works. Then I will demonstrate how Kinnexus is launched from Lycia. And finally, I will get to a simulator that now provide all the features needed for Kinnexus and demonstrate you like end-to-end workflow. Let's start with the Smart Launch. So on the screen, you can see interface of MediRecord's PMS. in the patient profile, in the clinical section, we have smart apps drop down, and we have all the apps from the yesterday's connected, and one of them is Kinnexus. So once I click on this link, it opens Kinnexus application. And as you can see, I don't need to re-enter my login and password for media records, since everything happens through OAuth protocol. And data about, as you can see, the name of resident is Planck Walker, and I have all this data in the Kinnexus. When I start filling the assessment, I have data pre-populated from the media records, like some demographics data, like given name, family, sex, gender, birth date, and so on. And also, we are working on populating more clinical data. I will cover it in more details during the launching Kinnexus from the simulator. Yeah, but the end goal to have almost all section fully pre-filled. Next example is Ilya. It is a HTA software that we worked closely to help them build some fire capabilities and smart launch. So as you can see, it works the same way. In the interface, there is a specific link for this particular case called like Kinnexus Smart Launch. Once I click on this link, it starts the Kinnexus. It uses the same OAuth protocol. And as you can see, in this case, the resident name is Kevel Benner, and it is pre-populated here, so I don't need to re-enter all this demographics data. When I start the assessment, everything is here. Yeah. So as you can see, this concept of like implement just one app and deploy it in multiple environment with different PMSs works pretty well. And now I will go to a full-featured demo that we are using HKS software simulator for this particular case. So how it will work. I will start with creating a new admission. Once admission is created, a clinical event is sent to the Kinnexus. So Kinnexus can display a special card in the HKS software interface that says that assessment is required to be filled in. After that, I will start the assessment in Kinnexus and enter, I think maybe just fill in one section of this assessment. After that, I will get back to the simulator and start entering other clinical data. So I will simulate a situation when two systems update the same data in parallel. Once I finished entering data in the simulator, I will get back to the Kinnexus and demonstrate you how data from two sources are merged. So I will keep the section that I initially created in Kinnexus, and then some additional clinical data will be pre-populated. Finally, I will submit the assessment, and the card from the simulator will go on. Then I will perform a discharge, and another assessment will be pop up that says that discharge assessment is needed. And for the second assessment, again, we will see pre-population for data from the previous assessment plus clinical data. So let's proceed with this more comprehensive demo. So this is a simulator that fully compatible with AU Core, Smart Launch, and CDS Hook specification. That's why I can demonstrate this whole full-featured workflow, but I hope maybe in next year we will retire and simulate, and we'll use software from our partners, who will build all these features in the solution. Let's proceed with admitting this patient in our facility. Let's choose that patient was admitted on 1st of December. On the dashboard, we can see information about the current admission. So it happens 1st of December, and now I will need to wait a little bit while the clinical event synchronization happened. So it happened. And we can see that this card from Kinnexus pop-ups in the interface of the HKS software. It is done through CDS Hook specification, so it's up to standard, and I can launch Kinnexus the same way as it was with two previous host software. I have all the data pre-populated, and now I will proceed with filling the assessment. So just to save some time, I will very quickly provide some dummy answers. So really sorry if it doesn't make sense from clinical point of view, but we have a data in our systems that make more sense from clinical perspective, and I will demonstrate it later on. Like for purpose of this particular demo, I just want to demonstrate that we have these 4 sections filled in. And we can just save it as a draft, and it sits in the interface here. These 4 sections filled in, the rest is not filled in. And let's assume that once resident is admitted, we keep entering more clinical data into the system. So, for example, I am at information about some medication allergies. Like this. Also, I am adding information about immunization. In the assessment, we are interested only in 2 immunization. It is pneumococcal and influenza. Pneumococcal should happen in the not less than 5 years from the time of assessment. So I can choose some date from past. And for influenza, we're interested only for the current year. So let's make it in October. Yeah. Next thing, adding some vitals. So I will set information about smoking status, height, and weight. Finally, I'm adding information about related person, and I will add a guardian. So as you can see, more information on the dashboard is displaying right now, information about vaccines, allergies, some observation, and information about related person. Let's proceed with filling the assessment. So I'm launching Kinnexus one more time. I have this assessment that I started to fill in, and I just open it for editing. So you can see that 4 more sections is pre-filled. So it was just this 4 in the beginning. And now we have information about health condition, particularly about smoking status. The next thing is vitals, so height and weight. In the treatment and procedure, we captured information about influenza and pneumococcal vaccination. And finally, we have information about legal guardian. So what we are doing right now, we are trying to map more items from the assessment into EU core data. And it is like ongoing process, and we are going to pre-populate more fields from EU core data set into the interRAI assessment, but it requires some additional effort, and we are actively working on it. Yeah. So let's proceed with completing this assessment. Yeah, and once assessment is completed, we can go to the simulator, update it, and you can see that card is gone now because we are in a good shape, everything is up to date, and so on. So if a person is admitted for more than 3 months, another card will pop up here saying that reassessment is needed. Or if everything went well and discharge happened, let's do it. So let's create a discharge. Let's create information about discharge. It is updated on the dashboard, and another clinical event is sent to Kinnexus. So we see this new card that says that discharge assessment is due. Let's launch Kinnexus and start filling this discharge assessment. So when we start a second assessment in Kinnexus, as you can see, like cognition section is fully pre-populated from the previous assessment because we can do it. For communication and vision, we need to like re-enter this data, and obviously all the data from the source PMS is pre-populated, like smoking status, vitals, yeah, and also I forgot to demonstrate like allergy to medication is pre-populated here, along with other part of assessment. And finally, a new section about discharge, pick up information about discharge date and like where the resident is admitted. In this case, it's aged care services. Yep. So I can proceed with filling this assessment. Yep. And the discharge assessment is done. So this card should go now. Yeah.
Yeah, that's great, and it's great to note, just for everyone else, that the discharge assessment there. Obviously, there's two reasons you would discharge into a different healthcare setting, and/or in the unfortunate circumstance that someone's passed away. But what we're looking at in terms of being able to send that data, is wrapping it up in a summary and being able to send it off, because it's in that FIRE format. It can be received by hospitals and other systems. So that's great. The other thing I'll say about this environment is in the aged care simulator, which Ilya is showcasing, is it's meant to emulate and represent any vendor clinical information system. So we've used this as an opportunity to be able to be able to showcase Kinnexus, but in the event that this was lead care, all of the observations and allergies and immunizations would be recorded as part of their normal business as usual, in their normal assessments. But the point is, when Ilya is bringing in the long-term care assessment, is that all of that data is pre-populated, and even when we're doing 90 days on, when we look at doing that long-term care assessment again, that starts to bring the longitude of the data, so that we'll be able to compare over time this resident's well-being, and then over time with reporting through the QIs, the department QI program. Over time, we'll be able to compare trends and analysis for that. So that is the benefit of recording it all in that standardized data format. The other thing I'll say about the CDS hooks that Ilya mentioned as well is each business is going to have its own rules in terms of displaying those cards to users, and that's a fully flexible system in which you would say, I want a reminder 7 days after someone had been admitted that they haven't completed the assessment, or I want one in 14 days. And that all depends on what your business rules are within your organisation. And I think that's a key thing about the system as well, in using the CDS hooks, is that's an easy configuration to do. So thanks, Ilya.
Yeah, and for final thing from my demo. So for this particular resident, we have a more accurate data in the Kinnexus. So I can demonstrate that we can calculate some assessment outputs like caps and scales. So first of all, we are displaying it here in the report section. So when open a patient profile, you can see this available data. And also, if I open the completed assessment, I can review all the answers, and in the right column, I have these outputs. If I would like to deep dive into this particular way, I can click on it, and it will demonstrate a section with all the answers, so I can identify why this value is like 14, and the same thing for health condition. Yeah. We are working on adding more outputs, and later on we will have more things like this and maybe embedded in other clinical workflows. And now I will pass it to Yana. So she will demonstrate integration with B2G and the whole workflow regarding the reporting. So Yana, please continue.
Thanks, Ilya. Let's talk a little bit about the statistics part of the system and the reporting. So let me demonstrate this part of the application. We talked about different types of the users of Kinnexus. And the first one was a nurse that Ilya has demonstrated. And now we have like quality manager and care manager who would like to see like overall the picture, what's going on in the facility. And with this type of the user, I can log into the Kinnexus and I can see the statistics dashboard. In like this case, I have logged in as a representative of Care organization. And for Care organization, I can see the statistics. We have like mandatory quality indicators for residents of Care. And the dashboard represents the following information. We have like high-level quality indicators categories here. And we also have individual quality indicators breakdown. Everything is calculated and represented. And I'll show you later on how it's changed on flight when we have more data in the assessments. You obviously can travel over time, can choose your like quarter that you would like to consider the reporting for, and then you can see the like past reports submitted to the B2G, and I'll demonstrate it like live in action later on. And you can see a source data, individual assessments that were submitted, and we can like dive in a little bit to the individual assessment, and this is a breakdown for particular assessment, like saying what quality indicators were triggered like by this particular submission. So it's a first step forward. Analytics capabilities that we are aiming for during the next year to be able to drill down to the individual data and provide like good tools for the management layer to prevent the discrepancies, to improve the quality of the reporting, etc. So it was for Care, and now let me log in as another organization. I'm logging in as a simulator organization, which is connected to the user from our simulator software. And here we have a little bit more data, a little bit more advanced statistics here. And now in real time, I will be contributing to these parameters. Let's see that one of the indicators is pressure injuries. And let's say one of the residents have additional stage 4 pressure injury. Let's add this data to the assessment, and let's see how it will be recalculated. I'm gonna need to switch the software to the simulator. And in the simulator, let's say the patient, the resident I have selected is a Samos Aaron. I'm launching Kinnexus here. And let's add this information to one of the existing assessments. I need to go to the skin condition, and we wanted to add a stage for like pressure injury. Yeah, probably that's it. Let's save this information. Sorry about this. Yeah, I can complete it. Yep, the status is completed. Let's go back to the dashboard. And now we can see stage 4 pressure injury. It was previously 3 and now it's 4, so it's obviously recalculated over here. And now what I'm doing, I can create a report. The report is like, I've seen lots of people still doing these spreadsheets. These are which are circulating across the departments. This takes lots of time and efforts for the whole clinical team. And right now, like, the whole report structure is represented in this digital form, and it's mostly pre-populated with the data that we have in Kinnexus. What does it mean? Like, we have 11 sections here. Out of 11 sections, 8 sections mostly filled, and only questions that you can see, like 15 out of 18 questions populated, right? We have a few questions that are not populated. It's because the questions declares that some residents were excluded from the assessment. By some reason, they were not presented in the facility. They did not provide the consent or something like this. So we cannot assume for the accuracy of the reports. We decided not to assume this based on the information that we have right now in the Kinnexus. That's why this last 2-3 questions in each category needs to be filled in manually. Basically, let's do like this, right? And some comments optional if you would like to add them. And for most of the categories, it's like this, just one question that you need to fill in. And at the moment, 3 categories like workforce, consumer experience, and quality of life needs to be filled in just manually because it's out of the scope of the long-term care facility assessment. But we already discussing how we can, what are the tools we can use to pre-populate this information as well in the future. So this is the structure of the report. I can submit it if I filled in all the sections. And let's see, I have one of the reports, let's say, in progress. I guess let's try this one. Not this one. Okay, I need to probably fill it in. Yeah, let's do this. Let's 1, 2. Okay. This one just populating with the numbers because otherwise we will be not able to submit. Submit it. This already done. Yes. Okay, filling in mandatory questions.
So, Yana,
yeah,
majority of the the report here was generated by the base data, the individual level data from the interRAI assessment, and then mapped
yes,
quality indicators. What you're
Yes.
showing here is the other elements around workforce, consumer experience, and quality of life, which is why we're filling it in. We appreciate that there may be other systems and or APIs that can be supported to connect this information in, but generally that wouldn't, I mean, not generally, that information about consumer experience and the numbers of nurses and minutes and things like that wouldn't come from the interRAI long-term care facility assessment.
Mm-hmm. Yeah, this is true, and we'll find together maybe some additional integration or any other way how to submit, how to feed it into the system. So probably we not gonna submit it right now because of some updates that recently been done. But like in general, when the application is submitted, we are able to send this to the B2G, and the like we working with B2G on the updated version, because they have published the version 2 of their APIs, and the version 2 is mandatory from the January. And as of today, we have updated the structure of the report to match the required data set. So I think that's it for now, because some error unfortunately happened during the submission at the moment, but we'll work on it.
It's a live technical of real software. So then you can know that it's not just a prototype, which is great. No, I think that's hugely beneficial, seeing, Yana, the individual long-term care facility assessments updated, and then the aggregate data flow through, be mapped to the quality indicator program for reporting purposes. So great. I think back to me. I think, Michelle, there's just a couple more slides, and then we will pass back to Len or open for Q&A. Thank you, Yana and Ilya. I'm sure there'll be lots of questions at the end, which you can field the tricky ones. This is essentially what we've done around launching Kinnexus from LeadCare. The importance of this when we talk about smart launch is that we can connect with many different clinical information systems, letting them keep their own assessments and other business as usual things, but being able to deploy Kinnexus very, very quickly. So I think with LeadCare, we worked with them over a number of months to implement this smart launch and also map a lot of their data into the long-term care facility assessment. And it's a great opportunity for vendors to upskill in fire and modern technologies like smart launch. So yes, if you're looking as a vendor provider combination to get involved and be part of our testing, then we would love to work with you. A couple of the next slides, I think, are really about talking about the context in which we've done the demo, so which Ilya has talked through. Being able to pre-populate data back into clinical information systems is hugely important as well, and that's something that we've been able to get working in the LeadCare environment with, Medicare numbers and other data so far, so that's good. We've talked about the clinical events and the CDS hooks, which is a part of it and referenced here for your info. We're on to the last one. The last slide, one more, I think, Q&A. And then the last slide, just to wrap up and tell you what we're doing in the next 3 months with Kinnexus, 3 to 6 months with Kinnexus, is we're looking to extend roadmap for development and resourcing by securing some funding. We are doing demonstrations, one-on-one demonstrations to key stakeholders. We are focusing on our testing and trialing of Kinnexus, so it's a great opportunity to get involved. We're looking for residential aged care providers, but also those that cross over into home care. We will look to stand up an interRAI home care assessment as well. I think there's a lot of crossover between that data and the long-term care facility assessment. So that would be another proof point that we would like to do. So Len, I'm going to need a copy of that, which will be another thing that we do in the new year. We are exploring how we take Kinnexus through formal approval of the implementation guide, and then just working on engaging more broadly with end users for clinical care managers and also nurses of the system. So looking at doing some testing with those. So if you are interested in being a part of Kinnexus Revolution, I would encourage you to reach out. The Kinnexus email address is on the screen there. And that's all we had for today. Well, back to you, Len, I suppose, as the facilitator.
Yes. Has anyone got questions? And we'll let you speak, of course. Radio silence. So the idea here that this is one way of introducing interRAI assessments and the processing of the quality indicator information out of that to virtually every software vendor in a jurisdiction, for example, Australia. So we've got multiple vendors. They all have an interRAI kind of plug-in, if you like, and it makes sure that the interRAI work is done accurately and all the QIs are calculated correctly, and it's all ready for transmission to the department. And for that matter, in a way, it's all ready for sharing with other software systems because of the way it's the outputs are constructed. So it's a fabulous idea, which is what Smart on Fire apps do.
We've got a question from Lisa, and I might get Ilya to answer this if that's okay, because he was the person who worked most closely with the software vendors. So Lisa's question is, what was the biggest challenge implementing Kinnexus with a software vendor?
So the most challenging part is data mapping. So usually most of software vendors, they're using some like custom their vendor specific terminologies, and they are not capable to like provide EU core SNMED code straight away. That's why we are not populating as much data as we can. It is the first challenge. Also, like not all the vendors support Fire and Smart Launch, but it appears that it's not so a big challenge to implement in a short timeline, and Ilya successfully demonstrated how it could be built. So yeah, I think this two things.
Thank you. That's such a good question, Lisa. And the other thing that we're doing in part of the next phase of our work is we're creating like a data mapper, like a repeatable solution where we can have, and I'm sure that's not the technical term, Ilya will kill me, but a data mapping solution where other vendors can use, it's a repeatable pattern where we can, you can come in, vendor silver chain with, another software vendor and map in your data and making it easier. So having those repeatable tools and patterns that we are using over and over again, where we're getting our bang for buck and where we're making sure that each lesson that we learn, we are then trying to find some smarter and quicker ways to be able to do that and sustainable.
Can Yana or Ilya tell us if an organisation already uses interRAI assessments as part of their assessment protocol, as many do in other countries, what's the value add of, I kind of know the answer, but I'm just putting the question to you. What's the value add of Kinnexus componentry? I know the answer. It's very positive, but can you explain to the audience how that might work?
Yeah, sure. I think this, in general, being able to following the guidelines, the standards, like interRAI, it's always great for aged care organizations. And let's say if the vendor already implemented some of the interRAI assessments and would like to leverage this experience already. Adding Kinnexus will add another, layer to the transparency, to the reporting, to the analytics. Because like for Kinnexus, we work together with the interRAI team to make these quality indicators calculated from already existing data. And I think it's a huge step forward for everyone, because it's not adding like new efforts from the clinical team, but it's adding the clarity on the reporting side.
Yeah, and it would, if Kinnexus has accurate analytics at the back of the interRAI assessment, even though we might have 10 software vendors collecting data, we can be assured that the calculations of the QIs and also all the other applications that come out of the interRAI system are all done accurately. In fact, you only have to fix it once, and then every vendor will have the correct answers without having to go through a big validation process. So I see that as a massive advantage. So, and it's also ready for data exchange. So not every vendor has to produce a data exchange solution because it's being done by, it has to sort out how to interact with Kinnexus, but Kinnexus can join the organisation to the rest of the world. So it's exciting. I'm mindful of the time. I know I have to be somewhere else in 1 minute. So maybe we'll conclude, but thank Meagan and Ilya and Yana for fabulous work. It's still a work in progress, but it is fabulous already, and it's going to be really good by the time they're done. And I think it opens the door to kind of really interesting possibilities for both interRAI and also for the quality indicator program, and in fact, for that matter, for data use in the industry, broadly speaking. So thank you very much. So in the last 10 seconds, Merry Christmas to you all. We'll talk to you sometime in late January, February. We'll have lots on next year. It's going to be a big year. I think decisions are going to get made about data solutions in Australia, we think, sometime during next year, and we want to be there in the room when the discussions happen. So let's hope it's all good for us. So have a good break. I'm sure you will, and we'll see you in the new year.
Thank you. Thanks for the invitation. Really appreciate it, Lisa and team.
Bye-bye.
Bye-bye.
For those of you listening to this conversation who may have further interests in interRAI systems, please visit our website, interRAI-au.org.